In this video, we'll talk about trigeminal neuralgia. It has two supplies. One is the sensory and the motor. Sensory supplies to the skin on the face and the motor supplies to muscles of mastication, right? So this trigeminal nerve has three divisions. One is the ophthalmic, maxillary and the mandibular. So in the trigeminal neuralgia, this mandibular nerve is most commonly involved. So what happens here, because of any hypertension or compression of this nerve, it can cause this sudden, unilateral, intermittent, sharp, shooting, stabbing or electric shock like pain, right? This sharp, shooting, stabbing or the electric shock like pain. So this pain is also along the distribution of branch of trigeminal nerve. Especially the mandibular nerve is involved, right? So there will be excruciating pain along this mandibular division. Mostly intense pain can be seen in the lips, gums, cheek and the chin along this mandibular supply, right? So the pain may be triggered by brushing and the washing face. Attacks are short and more frequent. There is no signs of sensory loss, but there will be only pain. So the things you have to remember here is, so first it is because of hypertension and the compression, and second, mandibular division is most commonly involved. So third, along the lips, gums and cheeks and chin there will be intense pain. How is this pain? This pain is sharp, shooting or shock like stabbing type of pain, right? And there is only pain, no sensory loss. So these are the 4 points which you have to remember. Now coming to the mechanism, so there will be ectopic generation of action potentials which will compress this underlying nerve, which will lead to demyelination of this nerve, and now this demyelinated nerve will go and attack this unmyelinated nerves. So because of this attack of this unmyelinated nerves, it will lead to intense pain. So that is the mechanism of this trigeminal neuralgia. So first there is ectopic generation of action potentials which will compress the nerve, which will lead to demyelinating of the nerve, right? Hyperexcitability nerve or the demyelination of the nerve. This demyelinated nerve will go and attack. So this demyelinated nerve will go and attack other unmyelinated nerves, and then the small unmyelinated nerves which will be responsible for this pain. So this is the mechanism. Now coming to the causes, first there is compression. So compression can be either by this artery or the veins or any bony structure like petrous ridge or the tumors. So these are the 4 things you have to keep in mind. So superior cerebellar artery can compress this trigeminal nerve root, and this tortuous veins may also compress this trigeminal nerve, right? And also petrous ridge compression and intracranial tumors, intracranial vascular abnormalities, post-traumatic neuralgia, multiple sclerosis, demyelination. So these are the things you have to remember. Number 1 is demyelination, multiple sclerosis and the post-traumatic neuralgia. So the other things are artery, vein, bone and the tumors, right? So this will compress this trigeminal nerve. Superior cerebellar artery, tortuous root of this vein, and this intracranial tumors or intracranial vascular abnormalities, petrous ridge compression. So for the treatment, you will give them carbamazepine. The side effect of this carbamazepine is agranulocytosis. And also you can give them anticonvulsants like lamotrigine, phenytoin, valproate. Local anesthetic injections can be given along the distribution, like alcohol or the glycerol can be injected along this nerve distribution. And also if the compression is because of any tumors or petrous ridge and all, you can decompress it, right? So decompression of the nerve by radiofrequency thermal rhizotomy, gamma knife radiosurgery. So you can remember this gamma knife, right? Gamma knife radiosurgery or radiofrequency thermal rhizotomy. So this is about trigeminal neuralgia. So just to summarize, trigeminal neuralgia has 3 divisions, out of which the mandibular is affected. So there will be intense excruciating, sharp, shooting or the stab like pain along this division. There will be pain in the lips, gums, cheeks and the chin, which can be triggered by brushing, washing face and all. So there is no signs of sensory loss, there will be only pain. So what is happening, all these action potentials are generated which will compress the nerve, which will cause the demyelination of the nerve, and now this demyelinated nerve will go and attack this unmyelinated nerves which will be responsible for this pain, right? So causes artery, veins, tumors and the bone. So this will compress this nerve. Along with that, you have to remember 3 more things, which is demyelination, multiple sclerosis, post-traumatic neuralgia. So the treatment carbamazepine, anticonvulsants like lamotrigine, phenytoin and valproate. Local injections into the nerve like alcohol, glycerol can be injected along this mandibular division, and also surgery for decompression if it is because of any petrous ridge compression or any artery compressing it. You can just go and surgically decompress it by this radiofrequency thermal rhizotomy and the gamma knife radiosurgery. This is about it. Bye.